Welcome, everybody, to another episode of The Big Idea. I am Dr. Jeffrey Hanna here at Atlas Health Australia in North Lakes, which is in North Brisbane. So what's the big idea? What do we talk about here on this little video here? We have a look at a few bits of research that's out there, boring, where they condense and talk about these really important ideas that unfortunately are not very accessible to the people who need to know this information the very most. So what we do is we have a look, hit some of the high points, and break it down into the core takeaway elements so that not just healthcare practitioners, but people, again, who are looking for this kind of information are able to find out that there are solutions to things that otherwise they probably don't know about. So what we're going to be looking at here today is going to be a review of neck injury and protection in vehicle accidents from 2019. We're not going to get too much into the physics of this one right here, but we're going to talk about and show the importance of neck injury, which is, I would make the case a bit of a silent epidemic. If you consider the things that we do, physical injuries to our neck, we consider what we're doing in front of our phones and our computers. We are, as a society, creating a world with all kinds of problems related to what? Related to this. And so what we're going to be doing in this particular video is we're going to be having a little look to see how this can show up in particular in car accidents, because oftentimes people are involved in these kinds of injuries, they don't do anything about it, and as a consequence they end up paying the price some many, many years later. That's what we're going to be focusing on here. So, per the always, is, firstly, if you're going to enjoy this video here, make sure that you do click that subscribe button, for the reason that that's how this information gets seen by the internet algorithms, so that other people who need to find this particular kind of information are able to get access to it as well. So, what we're going to do, we're going to get the ball rolling here, hit the highlights first. Although I'm going to be speaking a lot more and quoting a lot more things direct from this article. Nevertheless, here we go. Neck injury is one of the most common types of injury in vehicle accidents. The aim of the present study is to provide a summary of recent research on neck injury mechanisms, neck injury criteria, and neck injury prevention measures. The main types of neck injury resulting from vehicle accidents, including whiplash injury. So we're going to be emphasizing whiplash. And we're also going to be talking a little bit what they talk about as being neck injury criteria. It's on this note I really don't agree with some of the conclusions that these guys are reaching in this article, but let's sort of go through it here a little bit. Neck injuries vary in severity and in type. Okay, yeah, well, we can certainly appreciate that. Whiplash may result in one of several diagnoses such as ligament sprain, disc injury, muscle strain. So let me back up a little bit. What is whiplash? Whiplash by itself is not referring to an actual physical injury of any variety. Whiplash is the mechanism of injury, and it occurs when your head and your neck move suddenly one way and then the other way. So, sudden snap forwards, snap back, or snap back, snap forwards, or snap left, snap right, or any other combination of different directions that you can conceive. That is what a whiplash injury is. And so as they are about to discuss here, the consequence of having that kind of an injury is soft tissue, muscle, ligament, nerve. Not necessarily bone, muscle, ligament, nerve. Now, check this one out. Whiplash often occurs in low-velocity rear-end vehicle collisions. In the U.S., 90% of rear-end crashes are neck injuries. Check this one out. Traffic accident data compiled in Germany reveals that over 90% of whiplash injuries result from rear impact speeds of less than 25 kilometers an hour. So a lot of times, when people are first saying, they come to my office, I ask them, okay, have you had any injuries in the past? Oh, yeah, I just had a little car accident. Well, how much was a little car accident? Oh, it was just 60 Ks an hour. And I get it, in a car which is capable of going, hundreds of Ks an hour, relatively speaking, 60 is, relatively slow speed. Nevertheless, I offer people to do this challenge, and I don't literally want you to do this challenge. Legal disclaimer, don't do this. Nevertheless, I would have you imagine that what you do is you have somebody tie your hands behind your back, tie your feet together, and make sure that there's no way that you can prop and support yourself. And then have somebody trip you, push you in the back so you land flat on your face. That is the equivalent of about 35 to 40 Ks an hour. And you might be able to appreciate that if you're landing smash straight on your face, that's not going to feel real good. And guess what? It's probably also going to cause some really severe damage. Not necessarily on the outside, maybe some bruising, maybe a broken nose, but on the inside, the stuff you can't say or can't see per se. That's a bit of a mouthful. That's where the real damage can happen. And that's happening from 40 Ks an hour. Let alone you can appreciate 60, you can appreciate 80, or certainly even 100. And so the point that these guys are describing here in this report is that even the low speed can cause really nasty problems. As an additional bit, what I would recommend you do is go check out go into the Google search bar and search the Convincer seatbelt whiplash. It was a demonstration that they were doing around college campuses back in the US some many years ago, where they would strap the kids in and basically do a sudden stop going no more than 8 Ks an hour. And what you see is this whiplash effect happen. You see they're going and then just whack their heads and like, oh, that was really sore. And the point was being, okay, wear your seatbelt to protect you. But the annoying part is if you think about a seatbelt, it's going to protect your body. It does nothing to protect your neck. Nevertheless, better than nothing. So rear end collisions can happen, and they can be very significant even at low speeds, and they're associated with highest relative risk of whiplash injury when compared to lateral impacts. It means that it's going to cause more damage if you get hit from behind than if you get hit from the side. And I also want to add something here, and I don't have this particular study in front of me, but in brief, what some of the researchers had found, I'd read this one a while back, is that low-speed accidents are more likely to actually cause whiplash in these kinds of injuries. Why? Because when you've got high-impact injury, your car is going to crumple in on itself, and when it does that, guess what? It's absorbing the force to protect the person on the inside. Yes, they have, additional cages, but how do you think it's possible when people are doing the F1 racing or any of the other vehicle racing that they can get involved in speeds of many 100 Ks an hour, get out of the car and walk away? It's because the car is designed to protect and shield that person on the inside. Caveat, though, is when you have only the, quote, minor fender bender, the minor scratch or the bump, that doesn't cause the car to crumple, well, guess what? All that force on the inside is going to transfer whoever is on the inside in whatever position they so happen to be. So more women than men suffer whiplash and also suffer long-term symptoms. To the tune of about 3 to 2 is what these guys are reporting here. Now, this is, I've talked about this in other places, this seems to be a little bit to do with genetics and the way that men are built differently from women. In brief, women, as a general rule, and this is not an absolute, are more flexible than men. The consequence of that is that their ligaments are a little bit more stretchy, which means that they are a little bit more susceptible to these whiplash kinds of injuries. And this is believed why in soccer in particular, injuries in women are far more common than they are in men. Even though they're playing the same game, doing the same kinds of things, women actually have a higher rate of head-neck injury than men do. And I think that that's pretty common across the codes of football. In rear-end impact accidents, cervical vertebrae usually suffer a sudden, forceful hyperextension followed by hyperflexion. Cervical soft tissues suffer sprains and strains in this period, leading to a variety of clinical symptoms, such as headaches, dizziness, forgetfulness, and emotional psychological disturbances. While some individuals recover from initial symptoms within a few weeks after the accident, up to 50% develop persistent symptoms. In addition to that, they don't comment on it here, but it's not uncommon where the symptoms of a neck injury do not show up, sometimes for days or even weeks after that injury, and then we never think to connect 2 and 2. So what I want to do is I want to grab a little model here for you guys. And we'll try to get it. There we go, so that you can see what we're talking about here. So hyperflexion, hyperextension. This is the back of the skull. This is the top vertebrae in your neck, so your atlas bone sitting right there. This is your C2. It's the pivot point that lets you turn your head side to side like this. And then lower down through the rest of the vertebrae, what you have is you have these that are going to be called facet joints. And these are going to be on the back part. This is going to be essentially what allows for your neck to glide up and down, forwards, backwards, and also tips. I'm trying to do this without my hands getting in the way. Tipping side to side, something, there we go. Side to side, something like this. If you can see that one that's right by my finger there. And you also have in between these lower vertebrae, intervertebral discs. They'd be sitting right here. These are the major shock absorber cushions. There is no disc between C1 and C2. That's what gives you about 50% of all of your head and your neck movement. And so if you had a disc there, we wouldn't be able to do that as human beings. So what's the point of walking you through this? The point of this is that if and when a person gets hit from behind, and particularly if they don't see it's about to happen, because if you don't see it's about to happen, you don't have the ability to brace. If you don't have the ability to brace, then your muscles are not tense. And yeah, it's not a good thing to tear a muscle. It's really, really sore and uncomfortable. But if you've got a lax muscle, then any and all force coming from behind is going to go straight into the ligaments, which are more likely to tear. And ligaments have a much poorer blood supply, and so as a general rule, a much lower prognosis. It's a lot harder to heal a ligament than you would be to strain a muscle. So what happens in the course of the injury? The course of the injury causes essentially, there we go, this to happen. And this is the back again, and this is the front. It causes everything to shift backwards like this as the head snaps back. The joints shift, there we go, shift backwards, kind of something like this throughout the whole of the neck. That's the initial force. And you can appreciate how, firstly, what this is going to do is that this is going to stretch all of the muscles and ligaments along the front right here. And what it's also going to do is going to put some extra strain on some of the muscles through the back and the ligaments here also. But this is the damaging part. The hitting from behind, that's bad enough. It's when you suddenly go the opposite way. So you've just injured some of the stuff along the front of the bones. But then if the head snaps forwards the other way, aha, this is what happens. Then you suddenly stretch all of the nerves, the muscles, and the ligaments along the back. And it can lead to these kinds of issues that you see right here, where those facet joints between the vertebra actually can lift off and move like this. Now those joints, they actually are designed to move that way. So that in and of itself is not the problem. The problem is if and when you exceed the normal stretching ability of those joints to move the way that they are supposed to. That's when we can start to get into trouble. And so these guys, the Quebec Task Force team, they've classified what we would describe as whiplash injuries on a severity of 1 to 5. So 1 is no neck discomfort whatsoever, all the way up to fracture dislocation. Now, in this particular video, I'm not going to be talking about fracture dislocation. Why? Because if you're involved in these kinds of injuries, odds are you know it, and or you have the neck injury, and you get checked out by the paramedic, and they say something's wrong, we need to get you to the hospital, and they do CT exams and other different kinds of things like that to find out if there's damage, yes or no. So where we're going to be spending our effort is in the gray zone through here. So this is the one I want to pay attention to. It's what's called a whiplash-associated disorder, level 2. A combination of lateral bending and torsion results in unilateral facet dislocations, or, this is the important one, or unilateral locked facets, classified as whiplash-associated disorders, level 2. This kind of stuff is oftentimes not identified when a person first has these kinds of injuries. Why? It's because from the perspective of paramedics and emergency department room, physicians, rightfully so, what are they looking for? They're looking for the broken bones, the dislocations, and the major nerve trauma. So stretching the spinal cord, tearing a nerve, paralysis, lacerations, these really, really severe things, bleeding on the brain. So they look you over and they say, okay, we don't think that you have any of these things, so give it a few days. And then a person goes back to their GP, and the GP is going to say, well, or you're going to say to the GP, well, yeah, I feel sore. And sometimes, again, you may not be feeling any symptoms whatsoever. And the doc might say something to the effect of, okay, well, I don't think that there's any broken bones, and I don't think there's any dislocations, and I don't even think that there's any, quote, subluxations. This is what happens when you have, at least from a medical perspective, an unstable joint injury. So going back to this example right here, that would be something, well, this would be a straight up dislocation, something like this, where the joint surfaces are not in contact with each other anymore. Medically, a subluxation is defined when the joint is like all the way this way. So it's stretched beyond 50% of its normal motion there. Those usually can cause some really nasty issues as well. But, and this is the problem, what would happen if, as these guys are saying, unilateral locked facet? So let's say that it shifted this much, which may only be a couple of millimeters, maybe 3 millimeters, something like that. Is that not significant? I would make the case it can be. Very, very significant. Firstly, it's not normal. And if you've had a sprain strain injury to ligaments in your neck, well, guess what? Your brain is aware of the situation. And no matter how small it is, it can still be very significant. Here's an example. If you ever gotten an eyelash stuck in your eye, how good does that feel? My guess is probably not very much. Thank you. Very little. Well, how thick is an eyelash? It's 0.15 mils. That's 0.15 millimeters. That's it. Now, if you consider the size, and this is a giant model, mind you, but if you consider the size of the joint surfaces in the neck, they're approximately 1 centimeter in diameter, and they're relatively circular or ovular shaped. So 1 centimeter in diameter, your brain is capable of detecting and experiencing nasty pain with changes even as small as 0.15 if it don't belong there. And yet, from the pathological standpoint, people are told that it's only a quote-unquote severe injury if there's a broken bone, if there's a dislocation, or if the thing has near gone off of its perch all the way over like this. Or if you may have a part that's, compressing on the spinal cord. Then they're saying it's severe. But the problem is that you've got all of those other injuries that don't quite fit that pathological boundary, but they ain't normal. They ain't healthy. And so sometimes people say, okay, well, maybe I need an ultrasound or I need an MRI. Being honest, MRIs and ultrasounds, they don't have the resolution just yet, at least most of them, to see these kinds of injuries. Simply put, why? Because they're so small. You see, when you're looking at major injuries such as arthritis, fractures, dislocations, you can see the structures pretty clearly. Why? Because they're of a pronounced size. But these particular injuries that I'm talking about, that can be caused from whiplash type of injuries, these affect things at a molecular level. These things stretch the individual muscle, ligament, and maybe even nerve fibers in the neck. Those don't show up on an ultrasound or an MRI because they are too small. But unfortunately, we're told, yep, I had the scans and everything looked like it was normal, so everything must be normal. That does not necessarily mean that everything is normal. Now, rightfully so, what a lot of docs do say is they say, give your body a few days to see if it comes right on its own. Okay, good. Well, guess what? You should be getting better within about 3 days, is the short of it. If you are experiencing issues that are persisting beyond the 3 days, and you think, oh, it'll come right, you're kidding yourself. I'm not saying it's going to be 100% fixed and healed in just 3 days, but I'm saying that if you have an injury, something like this, like that. If your body's going to be able to pull, and again, if it's a severe and medical emergency, act immediately, if you know about it. But let's say it's like this, and you're thinking, okay, yep, my body should be able to bring that thing back in like this. Good, great. But what if it doesn't? What if those muscles, those nerves, those ligaments have been injured from the whiplash, and as a result, they're not able to pull the thing back in where it needs to be? Then what happens is the injury persists, it accumulates, and it continues to cause problems. In other words, it's going to heal, but it's probably going to heal the wrong way. And this is then where so many people can get into the long-standing kinds of issues. Why? It's because from the standard perspective, they're only looking for, again, these major kinds of issues. Or if it is, quote-unquote, relatively low grade, work and do some stretches. Go see your physiotherapist. Go see your massage therapist. Work with an acupuncturist. And don't misunderstand me. All of these things, really good, really important, and essential to help so many people who experience these kinds of injuries. But the caveat that I want to point out there is that very few of them are actually looking for these particular kinds of injuries, whether they occur in the lower part of the neck, whether they're occurring in the, especially if they are occurring in the upper part of the neck. How do I know that? I know that there was a study done very recently where they found that the single most area where injuries were overlooked was between the base of the skull and the C1 vertebra up at the very top. And it was usually because they just do a quick screen. And again, this is not a knock on anybody because we're all human. I am not perfect either. Simply put, they're looking again for those major signs of either dislocation or a fracture because it's such an important area. It's only where the vital life centers of your brain are. And they say, okay, yep, if it's not broken and if it's not dislocated, it's okay. We're all right with that. But unfortunately, because of how this joint actually moves, it lets you do this with your head. There are so many other ways that it can become injured, trapped, and essentially heal the wrong way that it's not even funny. And because of the sensitivity of the nerves in that area, it can go on to cause a whole bunch of issues. And so, yes, this is the point in the nature of the work that I do as a upper cervical chiropractor. It's looking to see, has a person suffered a physical injury where it's not broken, it's not dislocated, and maybe it was caused, or at the time you thought that everything was okay because you didn't have immediate pain, or maybe you did, but you thought it would go away, but the problem is the issue has persisted, and you have done the stretches, you've done the exercises, you've done the gym work, you've done all of the right things. Because you do the right things, your body should be able to heal itself. And yet, the problem persists. So what that means most likely is it's because there is something that's stuck. There is something that is interfering with your body's normal ability to heal itself. And one of them possibilities then, at least a major one, I would argue, is if and when you have those joints that have gotten locked out of position. And they may only be a few millimeters, but they can nevertheless cause some very, very severe issues. But the good news is if you are able to address those, and frequently you don't have to use surgery, you don't have to do incisions, you don't even have to twist or crack a person's neck. That's one of the good things, is when you can find out this is the exact location, direction, degree, this is the way that it has actually gone. Your body is begging and wants the opportunity to be able to resolve the issue on its own. It just needs that little bit of extra momentum. If you can give it just what it needs, just the right amount of force to overcome that lock, to overcome that point of inertia, the thing starts to be able to move again. And then guess what happens? Your body starts to be able to do what it is supposed to do, that is heal and repair itself. And as that does that, presuming that there was no permanent neurological injury, guess what? quality of your life should start to be able to improve. And so many of the different signs, symptoms, problems that they're describing here, again, the headaches, the dizziness, the forgetfulness, and the emotional and the psychological disturbances, we should expect to see those things start to improve just as well. Complete aside here, although it's not really complete aside at all, is from a symptomatic standpoint, there is actually no distinction between a whiplash injury and a concussion. And the reason for that is because the neurovascular structures, guess what? They're exactly the same. And so it's important that a person, if they've had the head injury, that they not just, get it looked at the skull, but they also have their neck looked at. This is a challenge. Again, please don't do this. But with the exception, perhaps, of blunt force trauma, is it possible to injure your head without injuring your neck? Now, I would make the case that the probability is pretty low. So people, especially when they're in the sporting environments now, yes, they're getting the brain MRIs and the CTs. Okay, do you have a concussion, yes or no? But they're not getting the neck looked at. And this is the other point that I wanted to raise. This article right here, and for the rest of it, what do? They get into mechanisms. We already talked about that. Threshold for muscle damage is difficult to judge. We've already said that. We mentioned a few of the ligaments, and it gets into a bit of the physics and how do you prevent it. It's kind of tricky, and they talk about some fancy cars and things like that. But the core of it that I wanted to talk about right here, we've already covered. But it's simply this, is you can experience whiplash injury. It doesn't have to be from a car accident. It can be sporting collision, including, believe it or not, swimming. How does that happen? Swimming's a non-contact sport. I get it, it is. Unless you smack your head into the side of the pool, or you smack your head into a sandbar coming off of a wave. Or you can imagine surfing, jet skiing, the way that your body gets snapped around. How about dance? You're just doing basic dance on your own, but if you slip and your body goes down at just the wrong angle, everything goes flying, snaps one way, snaps the other way. Remember, that's the definition of a whiplash. Head go one way, head go the other way, damaging head, neck, and all the interface stuff in between. It could be trampoline accidents. It can be heavy metal concerts from head banging like this, getting hit from the side in a mosh pit, any number of different ways. My point is, it doesn't have to be a car accident. There's a lot of ways that we can hurt ourselves. And then you put us in front of our devices, our computers, for hours and hours on end. That's when you start to develop and have the accumulation of these repetitive stress strains. Because if you've had that pre-existing damage, that is what really starts to accelerate the process then when you're beating yourself up here all of the time. So what does it mean? It means, A, make sure that you are not doing the things that are destroying your neck in the first place. But B, what it also means, it means very important that if and when you've ever had one of these kinds of injuries, even if it's not necessarily causing you pain in that moment, even if somebody else told you, yep, it's all okay. If they're looking at it from fractures and dislocations, you might be fine there, but you haven't gotten cleared to make sure that you didn't have one of these smaller injuries that nevertheless can cause the big kinds of issues. And it's not like every single neck injury or trip or fall or spill you ever have is going to cause something like this. No. But what I am saying is that when these things happen, it's really important to get it properly checked out to make sure that everything is okay. Because if it isn't, if you get on top of it right away, you can usually solve it and it's not an issue. But if you let it go for a long enough period of time, it will inevitably come back to bite you, in which case it's going to take a lot more time and effort and energy and investment on your part in order to solve it. And of course, we all do the very best that we can, working together as a team. Nobody has all of the answers for these kinds of things. We simply know that we have a very important piece of the puzzle, especially in terms of, again, how we look at the individual joints of the neck, doing the particular approach that we use here. In brief, it involves specialized imaging so that we can see when you actually have had these injuries, where are they, how have they actually gone? Because I said you can't usually see them on the standard MRIs, but guess what? If you change the angle just a little bit, because everybody's architecture is on the inside, that's how you can actually see, number one, what actually happened, but B, what can you do about it? And usually there's a lot of things that you can do about it. So even though I've been talking throughout the course of this video about all the things that can go wrong, there's a lot of things that can start to go right if and when you start doing the right thing. So I do hope that this video has helped just explain a little bit about, ways that we can injure themselves, but also then giving you a little bit more clarity in terms of what you may want to consider doing about it. And make the offer as well that if you have had that kind of neck injury, if you've already been to a lot of different people, including maybe even other chiropractors, that if you haven't had it checked out from an upper cervical chiropractor, that is somebody who focuses in this particular area of the body in very high definition, in very high detail, it's probably worth having a look at that. So if you want some more information about that, I'll encourage you to go to our website, which is atlashealth.com.au, where we have a whole bunch of other articles on all kinds of different conditions that can be related to the neck. Number two, like we said in the very beginning, make sure that you click the like, the subscribe button here. So again, you are getting updates when we do other videos like this. Number three that we would have you do then is that if you have enjoyed this video, that you would please share it with other people who need to know this kind of information as well. And it's because, again, by and large, people aren't being told this, and as a result, they don't know this. So it's only when you come across and learn about this information, you may have a friend or a family member who's been involved in some kind of an injury, but, oh, come right, or they don't know what's going on, or they're not being directed the right way to reach that resolution. Send this video to them so that way, you can make a big difference, in their quality of life as well. So I think that's pretty much everything that I've got for you guys here today. So on that note, I will leave you. Enjoy the rest of your day, your time, wherever you so happen to be. We'll see you next time. Take care. Bye-bye.